Did you know that in 2022, there were 249 million cases of malaria and over 608,000 deaths? But what is malaria, and how does it affect us? Malaria, a life-threatening disease primarily found in tropical countries, is transmitted by mosquitoes. It's not a contagion that spreads from person to person like the common cold. Instead, it's caused by a parasite that finds a home in our blood cells. The symptoms of malaria can vary from mild to severe. Some people might experience a slight fever, headache, or chills, while others could face life-threatening complications. Unfortunately, in severe cases, this disease has the potential to be fatal. Understanding malaria, recognizing its symptoms, and knowing how to prevent it is crucial. By doing so, we can protect not just ourselves but our loved ones as well. So, it's important to understand this disease, its symptoms, and prevention methods to protect ourselves and our loved ones. But who is more susceptible to this deadly disease? Let's delve into that. Certain demographics are at a higher risk of contracting malaria. Infants and children under 5 are particularly vulnerable because their immune systems are still developing. They don't yet have the necessary defenses to fight off the malaria-causing parasites. Pregnant women are another group at risk. Pregnancy reduces a woman's immunity, making her more susceptible to malaria infection, which can lead to severe complications for both the mother and unborn child. Travelers from non-endemic areas also fall into the high-risk category. Their bodies haven't developed any immunity against malaria, making them easy targets for the disease. Lastly, individuals with HIV/AIDS are at a heightened risk. Their compromised immune systems struggle to combat the malaria parasite, leading to more severe manifestations of the disease. The common thread here? All these groups have immune systems that are either underdeveloped or compromised, making them more susceptible to the deadly disease. Therefore, these groups should take extra precautions to avoid contracting malaria. So, how does malaria spread, you may ask? Let's dive right into it. The primary culprit behind the spread of malaria is none other than the mosquito, specifically the female Anopheles mosquito. But not just any mosquito. The story begins when this mosquito bites an infected person and ingests the malaria parasite, Plasmodium. The parasite then undergoes a series of transformations within the mosquito, finally making its way into the mosquito's salivary glands. When the mosquito bites again, it injects the parasite into the next person, continuing the cycle of infection. But mosquitoes aren't the only way malaria can spread. The disease can also be transmitted through blood transfusions and contaminated needles. Though these methods are less common, they are equally as dangerous. For example, if blood from an infected person is used in a transfusion, the recipient can become infected with malaria. Similarly, if needles are shared or not properly sterilized, they can also spread the disease. Now let's talk about the parasite itself. There are 5 species of the Plasmodium parasite that can cause malaria in humans. 2 of these pose the greatest threat, Plasmodium falciparum and Plasmodium vivax. P. falciparum is the most deadly, often leading to severe malaria, and it's most common in Africa. On the other hand, P. vivax isn't typically as life-threatening, but it can cause recurring bouts of malaria, and it's widespread in many parts of the world. It's important to note that malaria doesn't spread directly from person to person like a cold or the flu. You can't catch malaria from being near someone who's infected. It's only through the bite of an infected mosquito, a contaminated needle, or a blood transfusion that the disease can pass from one person to another. Understanding how malaria spreads is key to preventing it, and prevention is our best weapon in the fight against this deadly disease. Stay tuned to learn about the symptoms and testing of malaria in our next segment. What are the early signs of malaria and how can it be diagnosed? Malaria, a life-threatening disease transmitted by mosquitoes, often begins as a vague discomfort before escalating into a more severe condition. The initial symptoms of malaria are nonspecific, which means they can be easily mistaken for those of other illnesses. Early signs include fever, headache, and chills, which may seem no different from a common flu. Fever is the most common symptom, often accompanied by a headache and chills. It's crucial to note that these symptoms can start as early as 7 days after an infected mosquito's bite. However, in some cases, symptoms may not appear for several weeks or even months, particularly in cases involving the Plasmodium vivax and Plasmodium ovale parasites. Now you may wonder, with such common symptoms, how can one distinguish malaria from a simple cold or flu? This is where testing becomes vital. Due to the nonspecific nature of these symptoms, it's essential to get tested if you suspect you've been exposed to malaria or if you've recently traveled to a tropical region where the disease is prevalent. The diagnosis of malaria is confirmed through parasite-based testing, which involves examining a drop of the patient's blood under a microscope. Severe symptoms require immediate medical attention and include signs such as severe anemia, respiratory distress, and organ failure. If left untreated, malaria can lead to complications and even death, emphasizing the importance of early detection and treatment. A special mention must be made about malaria during pregnancy. It's a significant cause of maternal mortality, premature delivery, intrauterine growth retardation, and neonatal mortality. Pregnant women, particularly those experiencing their first pregnancy, should be extra vigilant about any malaria-like symptoms and seek immediate medical attention. Early detection and treatment of malaria can save lives. Remember, when it comes to malaria, time is of the essence. So don't wait to seek help if you suspect you or a loved one may have contracted this deadly disease. How can we prevent malaria and what's the treatment? Let's dive into the intricacies of prevention and treatment. Prevention primarily revolves around two strategies: mosquito bite avoidance and vector control measures. Mosquito bite prevention includes using insect repellent, wearing long-sleeved clothes, and using bed nets, particularly those treated with insecticide. These methods aim to reduce the contact between mosquitoes and humans, thereby mitigating the risk of infection. Vector control measures, on the other hand, involve controlling or eradicating the mosquito populations. This can be achieved through various means such as insecticide spraying and the introduction of natural predators of mosquitoes. Travelers planning to visit malaria-endemic areas should consult a healthcare professional for appropriate preventive medication. These medications can greatly reduce the risk of contracting the disease during travel. Another key preventive measure is the use of preventive chemotherapy and vaccines. These are designed to stimulate the immune system to fight against the malaria parasites, providing a shield of protection to those at high risk. Now, let's talk about diagnosis and treatment. If malaria is suspected, it can be confirmed through parasite-based testing. This involves examining a blood sample under a microscope to detect the presence of malaria parasites. Once malaria is confirmed, treatment involves the use of various anti-malarial medicines. The choice of medicine depends on factors like the type of malaria parasite, the severity of symptoms, and the patient's overall health condition. However, it's important to note that drug resistance is a growing concern. Some malaria parasites have developed resistance to commonly used anti-malarial medicines, making treatment more challenging. This highlights the need for continuous monitoring and research to develop new and effective treatments. In conclusion, combating malaria is a multifaceted task requiring a combination of prevention, early diagnosis, and effective treatment. It's a collective effort that involves individuals, communities, healthcare professionals, and global health organizations. Remember, prevention is better than cure, especially when it comes to malaria. What are the global efforts to eliminate malaria, you might ask? Well, it's a multi-pronged approach that involves both interrupting local transmission of the disease and preventing its re-establishment once it's been eradicated. Imagine malaria as a chain, each link representing a case of the disease. The goal is to break this chain at every possible point. This is done through preventive measures, early detection, and prompt treatment. The World Health Organization has certified several countries as malaria-free, a testament to the effectiveness of these strategies. These countries have demonstrated that it is indeed possible to break the chain of transmission and keep it broken. But the fight against malaria doesn't stop at eradication. Malaria surveillance plays a vital role in these efforts. Think of it as a radar system, continuously collecting and analyzing data to detect any resurgence of the disease. This allows for a quick response to prevent the re-establishment of the disease. The battle against malaria is a global one, but it's a fight we can win. And every victory, every country declared malaria-free, brings us one step closer to our ultimate goal. Together we can make a world free of malaria. That's a wrap on our deep dive into malaria. We've learned about this life-threatening disease transmitted by mosquitoes, primarily found in tropical countries. We've discussed who's at risk: infants, children under 5, pregnant women, travelers, and those with HIV/AIDS. We've understood how it spreads, not just through infected mosquitoes, but also through blood transfusion and contaminated needles. We've covered the symptoms, the importance of testing, and the crucial prevention and treatment methods. And finally, we've looked at the global efforts to eliminate this disease. Remember to subscribe to our channel for more informative videos like this. Stay safe, Stay informed.